Welcome to my live section. I'm so excited to have you here. Today, we're talking about something very, very important, an interesting topic that affects millions of lives every single day, and that is diabetes mellitus. You might know someone living with diabetes, a parent, a friend, a patient if you're in healthcare. But how do you really understand the disease condition? How do you really understand it? So today we are going to talk about it, how it's been managed, and all that and all that and all that. I did this live before, but I was cut short by network. So I have to go live again. So if you're joining me, just indicate on the comment section so I can keep you guys engaged. Okay. Have you ever felt thirsty, urinating frequently, or having weight loss? Your weight before is no longer your weight now. You're reducing instead of adding. Is it reducing drastically? Or have you ever thought of it? Hello guys. We're talking about diabetes. Like I asked before, have you ever been thirsty? Have you ever been urinating frequently all the time? Or have you ever thought of I thought this one is why. It's a very white light. I don't know something I can. Okay. Hello. Welcome to Nancy's Forum, Health Teaching and Lifestyle. Here on this channel, we share a lot of useful health informations. We discuss about relevant health topics, health challenges on this channel. So join me as we dive in. I want to be Today we'll be talking about diabetes mellitus, and we know that is one of the public health concern worldwide. A lot of people have come up with this disease. So many people have had a lot of complications: diabetic foot ulcer, diabetic ketoacidosis. So many legs have been amputated because of this condition. And this is actually something that can be prevented. It's actually something that can be prevented by detecting it earlier. So, a lot of people have come up with complications from diabetes. So many legs have been amputated. This is something that could have been prevented. So, I want to talk about it, I want to discuss it today. So, in a nutshell, like today, I asked a question earlier. Have you ever felt so thirsty, urinating frequently, and all that? Having lots of weight loss could be a sign of diabetes. Now, let's look at different types of diabetes. We have type 1 diabetes. This one is usually starts in children and younger adults. We call it juvenile onset, and is insulin dependent diabetes mellitus. It's an autoimmune condition where the body destroys its insulin producing cells. The body destroys it. Autoimmune, the body fights against it. So patients or children or younger children who has type 1 diabetes will need insulin for their life. It's actually a serious condition. Yes, it happens in younger children, younger adults. Is why we call it juvenile onset. And another type of diabetes mellitus is type 2 diabetes. This one occurs in adults. But these days now, due to the climate changes, even younger adults, you see someone between 20, 25, 30 is coming up with this disease too, this type 2 diabetes. So it's mostly linked to lifestyle. It's mostly linked to poor diet. It's mostly linked to obesity and sedentary lifestyle inactivity. So let's dive in and talk about it. So another type of diabetes mellitus is gestational diabetes mellitus. This one occurs during pregnancy. It can happen to any pregnant woman. It can happen to anyone. So and sometimes it disappears after the pregnancy period is over, or sometimes it continues later in life. So but this gestational diabetes increases the risk of the person developing type 2 diabetes mellitus. Okay, let's dive in. Please, if you're joining my live, let me get a comments. If you have any question, indicate on the comment section. Indicate on the comment section or drop drop a like for me. Like this video. Okay, now let's look at the red flags. The red flags to watch on the signs and symptoms of this disease we're talking about. I'm talking about diabetes mellitus. So let's watch out the red flags. If you or someone you know or your loved one is always visiting the toilets, the restroom, urinating frequently, especially at night. At night, it's not like the person is taking took lots of fluid. The person is urinating frequently and the person is having excessive test. You know, the more you're losing fluid, the more you have that a, excessive text to take more fluid. And then when you look at that person is having unexplained weight loss, it's reducing, diminishing. And then is always fatigued, is always feeling tired, and the person is having blood vision all the time. And then if the person have a wound and the person is the wound is not going, is not healing, or the person is having recurrent infections, I think it's time for the person to get checked. It's time for the person to go to hospital for proper investigations, because this disease we are talking about is not something that someone have to ignore those signs, because when the complication sets in, my dear, all the quite difficult though. It's difficult to manage. Imagine someone living your normal life. At the end of the day, they tell you that your leg, they are going to amputate your leg, or how would the person feel? So this is something that someone can prevent when it is detected earlier. The person hasn't come up with lots of complications. Okay, now let's look at how is the diagnosis, how it's detected, how diabetes is being diagnosed. It's usually during blood tests. You do fasting blood sugar, do a fasting blood sugar. If it's 126 milligram per day or more, and then or above, random blood sugar, of about 200 milligram per day with symptoms. These values tells us how the body is managing glucose over time. So when you check at all these symptoms, I think it's time the person start getting treatment. Yeah, most people get it wrong. Managing diabetes isn't only all about drugs. It's not. Some people say, they just take drugs. It's, you manage with drugs. Management is based on three things. Yes, diet, exercise, and medication. It's more of lifestyle, okay? Diet, exercise, and medications. That's how the therapies we use. When you talk about diet, you have to eat balanced diet. Some people say, someone that have diabetes doesn't take anything sugary thing, doesn't take carbohydrates, doesn't take avoid carbohydrate completely, avoid this completely. This. See, you can take but a little quantity. Not like you don't take all those things at all. My body needs it. It needs all those food for its maximum activity. You understand? But in a controlled portion. In a controlled portion. More especially, you have to take food high in fiber, high fiber content food. And then you reduce in refined sugars. Reduce your hand is taking refined sugars. But I don't take. Some people take, like I have one a client that always consumes this Coke all the time. This Coke, Coke, all this canned Coke. Take it all the time. You can even consume 3 bottles in a day. The man's legs is amputated today. He came up with diabetes. His legs is amputated today. So you have to watch what to eat. Diet, exercise, and medication. There are three strategies to use in managing these disease conditions. Okay, so when you talk about type 1, like I said before, is insulin dependent. Someone who have type 1 diabetes is no need insulin for the rest of his or her life. So that's of type 2. Give oral hypoglycemic agents like metformin. Sometimes insulin is needed. If it's needed, you can give a subcut insulin therapy too. Then you monitor the person's blood sugar level. Yes, you monitor it every few months. But more especially, you have to monitor what you eat, exercise, take your medications. Can I get a high in the comment section, please? So let's look at. Can I get a high in the comment section? Welcome to my live. Welcome to Nurse Nancy's Forum, Health Teaching and Lifestyle. Here on this channel, we'll discuss a lot of health topics, disease conditions, healthy lifestyles. We talk about it on this channel. So join me. Let's dive in. Today, we've already talked about diabetes mellitus, the different types of it, the causes of it, signs and symptoms, when to look out for, what to look out for in diabetes. Okay, you see, uncontrolled diabetes can silently damage every organ of the body. Yes, the eyes is affected, the kidneys too, the nerves, the heart, even your feet. So that's why early detection and prevention is very, very vital. You can live long if it is early detected. The person can live long if all those things, the risk factors, are being prevented. Live a healthy life with it. But the only thing with awareness and discipline, that's just us. Okay. Hello. you're joining my live, indicate on this comment section, please. Say hi in this comment section. Like today's topic is not interesting. Hello. Hi everyone. Let's look at prevention tips. So hello, live cameras. Welcome. Thank you for joining my live. You're welcome to North Nurses Forum Health Teaching and Lifestyle. Welcome. Today I discussed about diabetes mellitus. We talked about it, and we said is an endocrine disorders as a result affecting the entire body due to insulin deficiency of the body not taking up insulin for its maximum activities. That's what we talked about. And we've talked about the causes, we've talked about different types of diabetes, we talked about the signs and symptoms to look out for. And then we've talked about preventions, medications, and management. Okay. Hello, if you're joining my live, can I get a hi on the comment section? Welcome to my live. Okay, you see, uncontrolled diabetes can actually silently damage every organs of the body, the eyes, the kidneys, yes, the heart, even your feet is affected. That's why early detection, creating awareness like this can help prevent it. If you are not diabetic, prevention is possible. It's not this video, this live, this topic is not only for people that are diabetic. No, everybody is this for everybody. If you are not diabetic, prevention is possible. You maintain a healthy weight. Remember, obesity, like I said before, is a predisposing factor. You maintain a healthy weight. You eat more veggies, more vegetables, fruits, and whole grains. For people that like taking refined foods, like taking carbonated drinks, for people that like too much alcohol, no, all those things. I don't say you don't take, but take in moderation. Don't make it part of you. Okay, you limit your sugary drinks. Like all these people taking too much Coke all the time. You want to eat jollof rice, you drink Coke. You want to take snacks, you drink Coke. You want to eat gari, you drink Coke. You want to eat beans, you cannot eat your beans without drinking cold Coke, chilled Coke. People that if I any jollof rice, you see them, they will drink chilled Coke. They want to take snacks, they will take chilled Coke. They want to go out, they will take chilled Coke. See, all these Coke things you people are taking, it's not good for your health. To remember, complications of diabetes, amputated legs. See someone that is walking with her two legs one day, they tell you that the legs will be amputated because you have come up with complications of diabetes. They reduce your knee, oga, reduce your intake of sugary drinks. So it's not good for your health. It's not good at all. Limit your sugary drinks and alcohol too. And then you exercise regularly for people living sedentary lifestyles, like I've said before, from work to house, from your office to your car, from your car to your house, back to car, back to house. There is no time to exercise. My dear, is actually no healthy. It can predispose you to coming up with this disease we're talking about today. So you have to exercise regularly, and then you go for your routine checkups. For people that don't like going for checkups, go for routine checkups. Get your you can buy the equipment and keep at home. Be monitoring your blood glucose level. Yes, You can buy it and be checking it. If especially if diabetes runs in your family, if it runs in your family, if you are genetically exposed, just get the equipment, keep it in your house and be checking it. It's very easy. Anyone can check, do the test. Yes, a rapid test, you can do it. Okay. To buy the equipment and keep for yourself if it runs in your family. So, like I said before, diet, exercise, and medications. These are the three strategies to managing diabetes. Okay, managing diabetes. Like I said before, diabetes is not a death sentence. It's actually a condition that can be managed with the right mindset, medical care, and lifestyle choices. Yes. Please, if you find us today's lesson, today's topic valuable, please like, share, and subscribe to my channel for more information. And for more, join my live every day by this time. We'll talk about health, to discuss about health topics. Okay. I am very, very happy. For those that have joined, come in and go out. You all are welcome. I'm happy. I'm glad you joined. Thank you very much. It's still your favorite nurse Nancy. See you guys this time tomorrow. Thank you.